Hello everybody, welcome to Tell Me Everything. This is my very first video on this channel where I will be talking all things Reddit, social commentary, true crime, anything and everything that interests me and I hope interests you also. So without further ado, let's get into it. So today I will be sharing with you the story of Donna Monticone, a nurse who stole fentanyl from her patients. Now, if you know anything about medications and surgeries, fentanyl is actually a very strong pain-killing medication. So you can imagine the type of pain patients would have been in without this. And Donna was taking it. Donna was taking it for her own use, for her fentanyl addiction. So, let's get into it. Donna Monticone was born in 1970 or 1971. I actually couldn't find her birth date, but that is the information that I have currently, and that means she's probably in her 50s right now. And Donna is a former nurse who worked at the Yale University Reproductive Endocrinology and Infertility Clinic, which is an absolute mouthful, and so for the remainder of this video I will just refer to it as Yale. So Donna worked at Yale, and she graduated from the Bridgeport Hospital School of Nursing in 2015 and received her nursing license in 2016. At her role as a nurse, she also was responsible for managing medication inventory. So that is how I presume that she became in close contact with the fentanyl and how she was able to get away with her actions for as long as she did. It's actually unclear when Monticone's fentanyl addiction started. However, the Connecticut League for Nursing, the nursing board that actually reviewed this case and, rendered their verdict on Donna, reported that as early as 2020, she exhibited emotional disorders and or mental illnesses. Whether she self-medicated with fentanyl to cope with these struggles, or whether her addiction itself was categorized as a mental health disorder, it just remains open to interpretation. So we don't really know what precipitated her fentanyl use, but fentanyl is incredibly addictive. I mean, you might recognize the term or the name fentanyl from media coverage or TV dramas, where a mere trace exposure causes cardiac arrest or death. Someone goes straight into overdose. And this is actually kind of, it stems from the real dangers of illicit fentanyl use. However, in Monticone's use, this drug was pharmaceutical grade. It was not cut with anything else. It is made by pharmaceutical companies, by manufacturers, to a very strict guideline. So you wouldn't see anything within the fentanyl that you should not expect to see. So fentanyl is actually up to 100 times stronger than morphine and 50 times more potent than heroin. So within minutes, maybe even seconds, it's providing critical pain relief for patients who are undergoing surgeries or experiencing even, advanced cancer treatment. That is how much this medication was needed. And Donna was taking it. She was actually taking it from patients. Oh my gosh, there's so much more. The way she was taking it, the way she was hiding it, it honestly blows my mind that she got away with it for as long as she did. So, back to her role. With her role working with medications and, working with medication inventory, she exploited her position to the fullest. So, from June to October 2020, approximately 200 patients, mostly women, undergoing fertility procedures suffered the consequences of her actions. Monticone used syringes, listen to this, to extract fentanyl from vials and replace it with saline. Do you know what saline is? Saline is a harmless saltwater solution with zero pain relieving properties. Okay, saline is water. It's nothing. Okay, so some reports, some testing actually revealed that 75%, that's 3/4 of the clinic's fentanyl vials were either diluted or entirely saline. Entirely saline. I can't imagine being a nurse, being someone that's taken an oath, to take care of patients, to do my absolute best from them, and just, knowingly do this. But that's the thing with addiction. You only think about yourself. You're thinking about how you can satisfy your addiction. And Donna found a way. Donna, with her addiction, thought this was it. And that's what she was doing. And because of her actions, a lot of her victims were undergoing oocyte retrieval, which is retrieval of eggs from the ovaries, which is already painful and invasive. In order to get a good oocyte retrieval, you will have to be undergoing, rounds of injections into yourself to get your body ready, to make sure that the eggs that you're that your eggs or your follicles that are there are, that you're going to get the best egg possible in hopes of having a baby. And if you think about it, what Donna was really doing was interfering with people's dreams and hopes of having children. And that for me is most likely unforgivable. I just can't get behind things like that. So these victims that were undergoing these processes, these procedures, without proper anesthesia, they were experiencing pain, at risk of infections and internal injuries. I mean, some men at the clinic were also patients there, also required surgical procedures, and that they face similar dangers as well. So how was she eventually caught? So despite multiple patient complaints about excruciating pain during procedures, some even remained awake throughout the procedures, actually awake, their concerns were initially dismissed, which is really, really sad because, when you're a patient, the last thing you want is for your doctor, for your healthcare professional team to not listen to you, to be made to feel as if it's almost all in your head when you're incredibly vulnerable is not a feeling that I would wish on anybody. And it's terrible that these patients were dismissed so easily. It wasn't until a staff member noticed a loose cap on a fentanyl vial, and that is an unmistakable sign of tampering. That was when things started to go wrong for Donna. That is when people started to piece things together. They started thinking, oh my gosh, patients have been saying that they've been feeling this pain. And as I said previously, 75% of the clinic's vials were just saline. So when you're now seeing this tampering, this evidence of tampering, alarm bells have to start ringing. And the thing with medications, they will have batch numbers and expiry dates. So you can actually go back to the manufacturer and say, hey, my vial has, evidence of tampering. And the manufacturer, will check within their processes, their system, check their batches to see if there are any other complaints of, tampering. They will see if there was a problem within the process of, filling the vials and closing the vials, because this is usually, 99% of the time done by machinery, not by humans. So if there was something wrong with the machinery, so, those are the type of things that would happen. But when it became clear that this was actually a person that was actually tampering with the medications, all hell kind of broke loose. I'm not really sure how they kind of pinpointed it to Donna, but remember, she was, involved within the medical, medication supply and management. So I assume that, seeing her name on logs, maybe looking through cameras, they're seeing, XYZ was fine before Donna got a hold of it. And then afterwards, clearly they were seeing a trend. So after all the investigations were done, Yale removed Monticone from her role and notified the authorities. In a public statement, Yale claimed to have reviewed and improved oversight of medication and pain control. In my opinion, they completely downplayed the impact on patients, sending letters in December 2020 stating that there was, quote, no reason to believe, end quote, the incident affected patient health or outcomes. Which, I mean, I'm sorry, if I was undergoing an invasive procedure and I was in immense pain. I think that's affected my health. I'm no doctor, but I think it's safe to say. But you know, it's clear that Yale ignored red flags. You know, it's honestly, it's not a good look. It's not a good look. So what actually happened to Donna? So as a nurse, she faced both legal and professional repercussions. So the Connecticut League of Nursing was her district board. And so following their investigations by those professional standards, her nursing license was suspended for 6 months with mandatory weekly drug testing. After suspension, her license was placed on probation for 4 years with strict conditions. So she would have to undergo drug screenings. She required therapy and employer reporting. She was prohibited from solo practice and had 1 year restriction from accessing narcotics. I think that's a little bit loose. I mean, suspended for 6 months is a little bit wild to me. I mean, I don't know. Maybe I'm cruel. I think I would have thrown the book at her and just, you know, struck her off immediately. But in federal court, she then pled guilty to tampering with a consumer product. So on the 2nd of March 2021, she received 3 years of supervised release, 4 weekends of incarceration, and 3 months of home confinement. 4 weekends of incarceration? So that means that Monday to Friday, she was at home in home confinement. And then on the weekend, she checked herself into jail and then came back on Monday. And I think they actually did this because I think Donna had children. I'm not sure. I think she had kids and that somehow managed to work its way into the judge's or the jury's verdict. And she got 4 weekends of incarceration and 3 months of home confinement. I don't know. This just seems so, you know, so plain. Like, I don't know. I just felt like it should be more. But she since surrendered her nursing license, actually. I mean, I'm not sure which hospital would hire a nurse with that kind of track record that has a criminal record, you know, tampering with consumer products, and has been, you know, prohibited by her board from working solo for, you know, therapy and, you know, restriction from narcotics. I mean, that would be incredibly difficult to actually to do, I think. I mean, you know, you go get medications for your patients, you know, the fentanyl, the morphine might be in one cabinet and the other medication might be in another cabinet. I mean, how would you police that? So yeah, I think it makes sense that she surrendered her nursing license because, well, in all honesty, how would you work and who would hire her with that criminal record? So in the aftermath, you know, the patients took legal action against Yale. So in August 2023, 95 patients, some filing as couples, sued Yale for negligence, seeking $118 million in damages. In September 2024, Yale settled the lawsuit, agreeing to pay, quote, substantial damages, though the exact figure remains undisclosed. The New York Times even reported that Yale also made internal staff changes following the scandal. I mean, I think that Yale got off slightly easy. But kudos to the patients that, you know, didn't let this slide. You know, they deserved every single penny of that compensation. And I hope, wherever they are, I hope that they were able to, you know, get whatever that they needed and, you know, wanted out of their fertility treatments, out of their procedures, because, you know, that is really at the heart of this. You know, these were patients, people that were entrusted to Yale, you know. So yeah, it's really sad, and they deserved every single penny. Now, for me, I mean, I think the thing that really irritated me is just the fact that the patients were ignored, you know. I mean, I think it points to like a really prominent issue in the medical space. Like, women not being believed. You know, their pain is often downplayed or dismissed by medical professionals. And so that, I think, is what really contributed to delayed action. Yes, of course, there were male patients, but, you know, I can't help but wonder if it was all male patients or if it was a greater number of male patients than female patients. You know, would there have been quicker action by Yale? Would Donna have been arrested, you know, dismissed straight away? I don't know. But yeah, it's really sad to think that people were in so much pain and the person that was meant to help them, you know, was helping herself. But yeah, that is all I have for you today. So that is the story of Donna Monticone. And yeah, so I hope you liked this video. And even if you didn't, please, you know, leave me a comment. Tell me what you liked. Tell me what you didn't like. And tell me what you thought of Donna. Do you think her punishment fit the crime? Do you think it should have been more? Do you think it should have been less? Yeah, and what do you think Yale should have done in the aftermath of this? I mean, paying damage is one thing, but internal staff changes? I mean, you just fired Donna. Should more have been done? Let me know. Thank you so much for tuning in, and I really hope to see you next time. And if you got to the end of this video, could you leave me like a little purple heart so I know? Thank you so much, and see you next time. Bye.